The 13,000 cases represent an increase of 10% compared to 2022. From December 2023 to date, 709 malaria cases were reported. Other regions accounting for the majority of cases were Kavango East, Oangwena and Kavango West regions, with 8, 7 and 5% respectively. 87% of cases reported were local, while the rest were imported. This, according to the Health Ministry, is an indication of high ongoing local transmission. 28 deaths were reported in 2023. Malaria transmissions are highly seasonal, with most cases occurring during rainy periods. This puts over 70% of Namibia's population who reside in the northeastern part of the country at risk of malaria. Southern regions are fortunately not receptive to malaria. High-risk groups also include elderly persons, children and pregnant women. In 2021, the Ministry of Health and Social Services rolled out its indoor residual spraying campaign in 21 targeted malaria endemic districts. The campaign focuses on areas where the inhabitants are at risk and live in sprayable structures, provided there is evidence that mosquitoes feed and tend to rest indoors. Some areas are, however, experiencing a challenge in carrying out the campaign due to insufficient vehicles, lack of insecticides, and a delay in training by HR procedures.
For Omthia, the ministry does not have vehicles that can be used. But however, the ministry is trying to explore the issue of hiring community vehicles. When this process is concluded, and then the ministry will be able to start with the spraying in Omthia. For Omsati and Tsumeb, the issue is with the insecticides. So the ministry also is trying to procure or is trying to buy the chemical that can be used by the spray operators. So as soon as the procurement process is concluded on this issue, the spraying process will start. For Kavango East and Kavango West regions, the issue is with the recruitment process. So as soon as the recruitment process is finalized, so the spraying process will also start. For Zambezi region, the spray operators, starting from last week, they were in a training, being trained on how to spray. So that training should come to an end this week. So as soon as that training comes to an end, so the spraying process also will definitely start. So those are the few challenges that the ministry is faced with, and that's what the ministry is doing.